Hey girl gang, it's Dr. Joy here and you are watching Delivering Joy MD TV. It's Super Mama Sunday and today we are talking about a very important topic that sometimes gets missed in routine prenatal care, and that is about weight gain during pregnancy. Weight gain during pregnancy. Are you eating for two? You probably shouldn't be. Make sure you stay tuned for the details. All right, super mamas. So when we're thinking about pregnancy and weight gain, we really need to have some very specific ideals and goals in mind. One of the things that I see a lot is that people think that they should be eating for two. That is definitely a myth and not true at all. So during pregnancy, we really want to keep a few key things in mind. The first thing to keep in mind is our pre-pregnancy weight. All of us should know our body mass index, or BMI, prior to becoming pregnant to determine the appropriate amount of weight gain for you during pregnancy. So the body mass index is kind of your height to weight ratio. And while it's not a perfect measure, it is a very good predictor of the ideal amount of weight that you should gain. So a normal body mass index is at a healthy weight for their height traditionally. And I say traditionally because the BMI can be overestimated, especially for women of color or birthing people of color. So I like to kind of get an overall ideal picture of the woman's health, but certainly this is a good starting point for us to determine about healthy weight gain in pregnancy. If your body mass index is above 30, then you have a diagnosis of obesity. So women who have obesity should focus on gaining 11 to 20 pounds during their pregnancy. And so these are very important numbers because we know women who have excessive weight gain during pregnancy can be at risk for higher rates of C-section, higher rates of what's called fetal macrosomia, which means big baby basically. And we also know that these women often have higher risk of needing an operative delivery, whether that be vacuum or forceps or even cesarean delivery. So want to really pay close attention to that weight gain. Another really important point is that women who gain excessive amounts of weight can be at risk for more heart disease, high blood pressure, and even diabetes in pregnancy. So weight gain is very important. For women who have obesity, if they gain excessive amounts of weight, it can really play a role in making their pregnancy higher risk. We know that women who have obesity do have increased rates of like stillbirth and birth defects and even sometimes miscarriage. So very important to make sure that you are planning for pregnancy, that you are in the best health that you can possibly be in, and planning to have a very healthy and safe pregnancy. So in terms of calorie demands, we really want to pay close attention to the number of calories that we're consuming in a day. Remember that calories are actually energy increments. So that it takes a lot of energy for the body to grow a whole human. So we do want to make sure that we are getting calories from good sources. So we want to have a very healthy diet. We want to avoid junk food. We want to avoid artificially sweetened foods, so things that are processed like hot Cheetos and honey buns. Those are kind of the things we want to really limit in our diet and to make sure we're eating very healthful foods. These are going to be things like lots of fruits and veggies, lots of lean protein, and also paying attention to getting plenty of whole grain foods and low-fat dairy. I also post a link in the description box below on daily nutritional needs, and I think it's important to take a look at those. But this video is really just to kind of give you some assurance about how much weight is safe to gain and what sorts of numbers of calories that you need. And in first trimester, we need about 1,800 calories, which can be a little difficult for those moms who are suffering with nausea and vomiting of pregnancy, but we can certainly make a lot of those calories up with smoothies and protein drinks, and then certainly regular foods when you're able to tolerate those. In second trimester, just think 2,200 calories is what is our goal, our ideal amount of calories for the day. And in third trimester, 2,400 calories is about the energy demand that your body will have. So these are really important to keep in mind as you're going through your day. Learning to look at nutrition facts is a really big deal. So I'm going to actually link a video in the description box for that so that you can take a look at that and learn how to count calories. And finally, exercise. So I don't know where this idea comes from, but there's this big myth that pregnant women should not be active, that they should, lie down or sit down. No, pregnant women need to be active. When you get to the point of birthing your baby, you need every muscle in your body. So we know that birthing actually takes about as much energy as running a triathlon. So you need to be in great shape. You need to have your heart in great shape, your muscles in great shape. So I highly recommend moderate exercise most days per week. At least 2.5 hours per week of exercise is what you want to get. And we want to keep our heart rate. So if you've ever taken your heart rate, you want to keep that heart rate between 120 and 140. So just moderate exercise. You don't have to go running or jogging or anything like that. Just a nice brisk walk. Swimming is a great exercise. Yoga is a great exercise. If you want to do some weight-bearing exercises during pregnancy, that is totally okay. Whatever your body is used to doing prior to pregnancy, you can maintain during pregnancy. So my mamas who are weightlifters can continue lifting weights. I have moms who are still doing their CrossFit class. And so we really include some modifications to avoid any injury to the abdominal wall and certainly to the pelvis or the back, because we do know that our joints are a little bit more relaxed during pregnancy. So we want to avoid injury, but moderate exercise is totally okay unless your provider has told you that you need to be on bed rest. So get moving, mama. Hope you found this video helpful. If you did, give it a thumbs up and post any questions or comments in the comment section below. Make sure you subscribe so you don't miss a single episode of Delivering Joy MD TV. And we'll see you on the next video, Super Mamas. Peace.